Hey guys, my name is Cristal Acosta. I'm a licensed professional counselor in Texas, and I have a podcast called Through the Eyes of a Therapist. And this is my new YouTube channel. So bear with me. This is one of my first videos, and I'm going to be reacting to stuff. A penguin. Trying to apply what your therapist says. So cute. Okay, so this is totally true. When you start therapy or where you're in therapy and one of your clients is trying to acquire a skill that they might not be very good at, they might be frustrated, right? So I have also been a client in therapy, and sometimes my therapist will suggest something or has given me some psychoeducation about something. And they're like, hey, why don't you try this new technique? And I'm like, no, because it's so hard sometimes to have to do something that you're not used to doing that's probably really good for your mental health. So here this penguin is doing arts and crafts, which is probably really a fun thing to do, but then they're also hating it at the same time. So I totally empathize with this penguin. This is hilarious. This next meme is of Michael Scott. Being a therapist is easy. All you do is just listen to people. Me. Unimpressed. Yeah, when people say this, and people do say this, it's just such a downer and such a turnoff. Like, really, dude, you don't know what goes into being a therapist. First of all, it's really difficult. It's challenging. It takes a lot of mental effort. It takes physical effort, believe it or not, because you're sitting down all day or standing up all day, or it just depends on what kind of therapist you are. If you're like an ABA therapist or you're working with kids, just depends. You're doing recreational therapy or nature therapy. You don't know, right? What kind of physical things are involved there. And then you're also not only listening to people, you're doing all kinds of mental gymnastics, like reframing and thinking of the next intervention and actively listening and trying to empathize and doing all kinds of things with your brain that are going to help the person. It's not just sitting there listening. No, we're listening with intention. And that's what sets us apart from, sorry to say it, bartenders, hairstylists, your neighbor, unless your neighbor's a therapist, well then, but there you go. Okay, this is another cute meme. Therapist, you need to be more social. Invite more people over. First of all, we wouldn't give advice like that. Anyway, me, crying session at my house tonight at 8. Pull up. Yeah, I guess if, that person were to follow this therapist's advice, they would be crying so much because that's why they're in therapy, right? It's like, let's all just have a crying party. Why not? But yeah, back to the thing about advice. We can give suggestions, we can give psychoeducation, we can highly encourage things, but we cannot give advice. I don't think we should. I mean, there are different therapists that have different schools of thought on this. This is not how I was trained, definitely not. I was trained in a person centered way. And what that means is that the client or the person that you're treating has all the answers inside of them. And you don't have to be giving or handing the person advice or things that they need to solve the problem. It's much better for a therapist to try to get the person to arrive to that conclusion themselves. And that's so much more powerful. Also, it's a liability. What if this actually happened in real life and then there's like stuff that goes down? No, not good. Okay, now this meme, it says, you, something good happening. Okay, it's coming toward them. It's so great. And then your trauma brain is saying, you waiting for something bad to happen. Oh shit. Yeah, so um when you've been through traumatic events, and I'm a trauma therapist, so this is familiar to me in a lot of different ways. Sometimes clients, when they have something good come their way and they've been traumatized before, they're kind of hesitant because it's like their trauma brain is like, no, 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 don't get your high hopes up about that. Wait a second. We don't want you to get hurt again. So sometimes your trauma brain is a little active there, and what do? Okay, this one says, trying to be honest with my therapist, but not so honest that I get involuntarily hospitalized. And this girl is going through like laser beams, right? Like in these spy movies, trying to like navigate, not trying to get her limbs laser cut off. So this is actually kind of funny because therapists are just trained, right, to look out for and be vigilant of signs of distress, harm to self, harm to others, especially if it's imminent, right? So if a person is being really honest about their thoughts and feelings, and they happen to disclose that, they're feeling like unaliving themselves or unaliving somebody else, and we start to assess and ask them questions about how serious that is for them, and they tell us that they have a plan and the means and the immediacy is there, like, hey, they're going to do this when they get out of our office. We have a duty to keep the client safe, right? So it depends on a lot of other factors like the state laws and all that stuff. But anyways, here in Texas, where we practice, we've got to keep the client safe. And so sometimes we have to hospitalize the client or get them to an emergency room or some sort of mobile crisis unit to them so that they can be safe. And so this person is like, if I'm being really honest, they would probably be involuntarily hospitalized. So it's just, that's an interesting and kind of funny, lighthearted way to talk about unaliving yourself, I guess. I don't know. That's kind of a hard one to navigate there. Okay, here's another one. It says, it looks like a news brief sort of situation on the top with an article, and it says, how to explain what memes are to your therapist. Oh my God, initials, like an elderly woman. Okay, well, so this is kind of funny because I guess as generations move on, there are going to be things like maybe not memes. I remember when like Vines came out and I was like, oh, Vines are funny. I was kind of into Vines a little bit and I was in my like mid 20s, and then TikTok came out and I was really hesitant about getting onto TikTok because I was like, I don't know how to use it, and then my age was kind of starting to show. I'm barely getting on YouTube. And I'm like in my late 30s. And this is really funny because it kind of speaks to how a therapist really needs to kind of keep up with the times, especially if you're seeing clients that are of different ages. You have to be somewhat comfortable speaking about different cultural references. And it doesn't really have to do with age either, right? But in this meme, my hands are over here with the video. In this meme, it talks about how a client's or a therapist's age would maybe matter if a client is really young and they're having to explain to you, the therapist, hey, this is what a meme is. I mean, that's extra emotional labor on the part of the client. So, and last but not least, we have one with good old Mike Wazowski. He's talking to this lady who's the secretary. I forgot her name. It says, when you open up to your therapist and they pause before responding to you, your stunned silence is very reassuring. Yeah. So when therapists are trained or we're in training, we really practice a lot of like role playing. At least that's how I was trained. We role played a lot and we were really, really heavily supervised by faculty and other supervisors who were looking at our work. We had to even be recorded and like play back our sessions and show them in front of a class and kind of give each other feedback about how our reactions are perceived by clients or how they could be perceived by clients. So if a client tells a therapist something really deep and really interesting or some sort of deep dark secret or something that has like shock value, right? And a therapist is just like Mike Wazowski's face, then that's probably not gonna land well with the client, right? The client's gonna be like, what the hell is this therapist doing or thinking? So yeah, probably working a little bit more on what we call affect management Right. Like what's going on with the face. I tend to be kind of expressive when I'm not in session. But yeah, we got to work on that and really reassuring the client sometimes with our words whenever our face does not arrive there.